I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 81. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're going to talk about today is the connection between the gut and the brain, and how things like anxiety, depression, post-traumatic stress disorder, even Parkinson's disease may not be a brain issue. They might be a gut issue. And so many patients have come to me over the years. I've been in practice well over 3 decades. And they come to me and they say, Dr. Joe, I have anxiety, depression, ADD, ADHD, and we're taking the standard treatments, which I support 100%, but I'm not getting the results that I want. My kid still isn't doing well in school. I still can't focus. I still have anger issues. I still have post-traumatic stress disorder issues. And so what I found years ago, and now finally science is catching up, again, it's a Dr. Joe was right issue, was that every patient that came in that had an emotional issue had a digestive component, either undiagnosed or untreated. So we're going to talk about how the gut and the brain control each other. And you can't just treat one without treating the other. You're not going to get the results you want. And I know this because I've been doing this for a long time. Been in practice, 35 years now. I've missed a half a day of work in 35 years. So it's very rare that I don't go to work. I hit my head actually that day and I was dizzy and my staff sent me home actually. I didn't want to leave. They made me go home. So what we have to do is try to figure out why the body isn't working. And I've spent tens of thousands of hours researching all this. And so this allows me to talk about this because I know it works. Now, does it work on everybody? No. But there's always other options we can try. So let's talk about the gastrointestinal tract. It's one of the most complex ecosystems in the world. So we have more bacteria and more DNA in your bacteria than you have in your own body cells. We actually are just life support for bacteria. That's all we are. And so we have to take care of these bacteria. And there's good guys and there's bad guys. And they have a battle all the time. And we want to support the good guys. But we've got this complex micro ecosystem. It's called the microbiome in your digestive system. And we've got to learn how to take care of it. And very few people are talking about taking care of your gut. We might joke about it, but nobody talks about fixing it. And again, in my offices, I've always tried to get to the cause of the problem, not just treat the symptoms. Whether it's neck pain, back pain, shoulder pain, car accidents. I've never seen a car accident ever. If the car was damaged, the occupants weren't. I've never seen that happen. And patients come to us every single day. We have 3 offices. And patients come in every single day and they say, Doc, I was in a car accident and at first I thought I wasn't hurt. Or I went to the hospital, they checked me out, they said I was fine. A week, a month, a year, 6 years, 10 years later, whatever it is, I started having problems. And we do an analysis, and sure enough, it was because the body got whipped around in the car accident. You are not stronger than your car. So if a car was damaged, you were damaged 100% of the time, you need to come see us. I don't care if the accident was yesterday or if it was 50 years ago. Now, the sooner you get to us, the better. Because trust me, I deal with insurance companies every day, and they can be really mean. Oh, you weren't hurt. You didn't go to the doctor for a week. Well, my father died. I had that case happen one time. My father died. I had to go to his funeral. Not an excuse. You didn't go to the doctor. No kidding. That's not a lie. So we've got to get the digestive system working because it's going to affect the gut. 100 trillion bacteria, funguses, viruses, other microorganisms make up the microbiome. 100 trillion. It's a lot of stuff going on in your gut there. Advancing science have made it clear that it plays a major role in both mental and physical health. I mean, think how amazing your digestive system is. You eat something. It could be a salad, it could be a potato, it could be a cheesesteak sandwich. Your body is able to deconstruct that, digest it, break it down, and then reassemble it as toenails, or earwax, or nervous system, or eye tissue. It's fascinating what your digestive system can do. So kind of, when you eat food, you don't digest it. The acids in your stomach break it down. It goes into the small intestine. The small intestine then has these 100 trillion microorganisms, and they're eating it, spitting out what they don't want, and letting you absorb the rest. And we don't take care of the thing that takes care of us, which is your gut. So with all these different things going on, breaking down carbohydrates, proteins, fats, nutrients, supplements, your body has to break them down, absorb them, and then decide what to do with them. How does your body decide that this nerve needs B vitamins and then this one also needs B vitamins, but this one needs vitamin D? It's crazy what goes on in your body. It's very, very complex. So your body is composed, as I said, of more bacteria than you are human. And the connection between your mental health and your gut is so strong, this is a very profound statement, that many researchers, myself included, are proposing that the proper probiotics and the proper microbiome in the colon may someday replace antidepressants. And the reason I can say that, and again, I'm not telling you to stop your antidepressants, is that I've been doing this for so long and I've seen so many patients respond when we get the digestive system working. And sometimes it's physical. Sometimes the stomach is pushed up against the diaphragm. We need to massage or pull the stomach down away from the diaphragm. Sometimes it's chemical. We got to stop putting the bad food in, put the good food in. Sometimes it's emotional, which is then causing chemical reactions, which is causing physical reactions. So if we can get the body healthy, it works a lot better. I can't tell you how many patients we've had as pain patients. I'm board certified in chiropractic and pain management and orthopedics and nutrition. And pain patients come to us, chronic pain patients, and when we get them out of pain, their digestive system gets better. Because physical stress can create emotional stress, which can create chemical stress, and they're all related. You can't just treat one. So if you're having physical stress, pain, it's probably a good idea to come see us. Neck pain, back pain, shoulder pain, digestive pain, come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge, and we'll check you out and see if this is something we think we can help. And if we can, we will. And if we can't, we'll tell you that too. Fair enough. And the website, by the way, if you want to do it, is drjoe.com. So we're talking today about getting the body and the brain and the gut working together. But probiotics, this is what some researchers are finding, that the right probiotics may replace antidepressants. That's why I stress probiotics so much when I counsel you on diet and when we talk about supplements. There's two supplements I have. One is called Dr. Joe's Super Greens. The other one's called Dr. Joe's Essential Source. And two of the ingredients are prebiotics and probiotics. Prebiotics feed the bacteria in your colon. Probiotics are the bacteria in your colon. And we stress that the minimum amount of nutrients I want my patients taking is Dr. Joe's Super Greens and Dr. Joe's Essential Source. You need to do that too, because it has prebiotics, probiotics, digestive enzymes, complete multivitamin, circulatory compound, a plant-based compound. So Super Greens and Essential Source, minimum that you should be taking. And they're 2 scoops of powder. I mix it with water, coconut milk, almond milk, tastes great. Once you start taking it, most people are like, oh my God, I don't know how I live without this stuff. So the probiotics, and we also have a Dr. Joe's probiotic supplement for people who are a little more severe. And when we can build up the bacteria in your colon, it's just amazing what happens. Other research, severe and chronic mental problems, including post-traumatic stress disorder, might be eliminated through the use of certain probiotics. What a big statement is that? If we can get people with post-traumatic stress disorder, whether it's military, whether it's something that's happened in their lives, if we can get them back to dealing with these issues on a more stable basis, I don't want to say normal, but a more stable basis, wouldn't that be amazing? And so many people take the antidepressants and it contains it, but it doesn't fix it. The probiotics now, researchers are proposing, might fix the problem. That's pretty cool stuff. Specific mix of microbiome in the gut help determine the kinds of brain we have and how our brain circuits develop and how we're wired. This is one of the reasons why breastfeeding is so important for babies. Because if you're giving the baby breast milk, there's probiotics in there. And it can help build up, the baby's born essentially with a blank slate. I mean, they've got something in there, of course. But when you give the baby probiotics, it starts to colonate the colon, and that helps the brain function. And we see it, breastfed babies versus non-breastfed babies. I see it all the time. The breastfed baby's usually calmer, they're easier to deal with. Wow. Maybe nature decided that there was something in breast milk that we need. All mammals do it. It's really important. So ladies, if you're gonna have a baby, I do recommend breastfeeding. It's really important. Researchers have been able to examine the gut's influence on emotions by studying people with something called irritable bowel syndrome, IBS. Now, how many people have IBS? Raise your hands. A lot of you do. I know this because I'm in practice and I see you all the time. Now, IBS doesn't have a real clear, definitive test that we can run. The organs all appear normal, but they're having severe abdominal pain. Maybe it's gas, bloating, diarrhea, constipation. And when that happens, we call it IBS because we don't know what else to call it, irritable bowel syndrome. Syndrome means it's a bunch of different things. There's no specific test for it. And the treatment many times is just steroids to bring down the inflammation. Well, steroids do what? They can kill off the bacteria in your colon. Now, I'm not against steroids, please. I'm not picking on drugs. But the steroids can destroy the colon bacteria, which can then cause more digestive issues, more inflammatory issues, more brain issues. And if you ever took steroids, and I've taken them already, you blow up like a balloon. Okay? It really blows out your immune system. So now you're more susceptible to diseases like the cold and the flu because your immune system is being compromised because it's bringing down the inflammation. Pretty wild stuff. Now, sometimes it's necessary. I'm not saying it's not. But one theory proposed that IBS is rooted in dysfunctional information between the gastrointestinal tract and the brain. The brain and the gut are not talking to each other. That can cause communication problems. One theory is it originates in the intestinal wall, and that in IBS, there's faulty communication because those nerves in the colon are hypersensitive. And some people are more sensitive than others. I'm really sensitive to smells. People say, I don't smell anything. I say, you don't smell that? So I just have a acute sense of smell. So if the colon is more sensitive, and then you put things in there that are going to irritate it, what could those things be? Well, how about bad foods? I call them the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. I know you're saying, oh my God, Dr. Joe, that's my whole diet. I know most people eat that as the whole diet. It's okay. We're going to change that. We're going to work on it for you. So if you're eating the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, all of those can irritate the bowels. And if the nerves are already super sensitive, it's going to irritate them more. Anybody ever slam their thumb and then every time you touch it, it hurts? That's what's happening in your gut. So every time you eat bad food, it's just irritating the heck out of the intestinal wall, and you can't understand why you have abdominal pain. And then maybe we have to put you on steroids or painkillers, which again may be necessary. But it doesn't fix the problem, it treats the symptoms. And I'm okay treating the symptoms, but always think, what can I do to fix the cause? Whether it's headaches or neck pain or back pain or irritable bowel syndrome, we always want to get to the cause of the problem, not just treat the symptoms. So if that's the case, these IBS patients have a hypersensitive nervous system, and it can be irritated by chemical, physical, or emotional stress. And if you listened to my shows before, you know I talk about the 3 things you have to have in order to have good health: normally functioning nervous system, normally functioning digestive system, good nutrition. Chemical stress, physical stress. Once we fix the chemical and the physical stress, you're able to deal with the emotional stress a whole lot better. So why wouldn't you want to do that? I don't know. Maybe you don't know about it. Well, guess what? Now you do. No more excuse. You don't know about it. You know about it now because you're hearing it today. So if you have pain, how many people have pain? Raise your hands. Neck pain, back pain, shoulder pain, numbness, tingling. A lot of you do. I know. I see you in my practices every day. I get emails from you every day. 365 days a year. Christmas, New Year's, and that's okay. I tell you, go to my website, drjoe.com, and if you have questions, you can send them to me, and I'm more than happy to answer them for you. But every single day, people call up about or send messages about physical stress. Now, from a chiropractic standpoint, that's usually pretty easy to deal with. If you have neck pain, back pain, shoulder pain, numbness, sciatic pain, tingling, muscle weakness, chances are it's a pinched nerve. Now, not always, but chances are. So if you want to make an appointment to come see us and you're sick and tired of suffering, I think you should be at that point now, go to my website, drjoe.com. We'll set you up a time to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We're more than happy to work with you. Now, if you're not in the Atlanta area, you can always come see us. A lot of patients, I know the show goes all over the world, so a lot of folks will come in to see us, and we have patients every week or several times a week come in from other parts of the world. We can always do a phone consult as well. So if you want to do that, you can just call the office. We can get that set up. But the website, drjoe.com. You can also order the supplements, Super Greens, Essential Source, probiotics. Vitamin D is we're finding now is linked to a lot of emotional issues and pain issues and memory and fatigue. So vitamin D is important. Get your vitamin D measured. And if you're low, which most of you are, you're probably going to want to take about 5,000 international units of vitamin D, and that's on my website as well. So if you're not willing to do anything else, at least start getting the chemistry fixed. Go to my website, drjoe.com. Get the Super Greens, the Essential Source. The probiotics are good. Again, the vitamin D, you might need digestive enzymes. We're going to talk about that a little later. We have a B complex that I take every single day and adrenal support. My adrenal glands, as I get older, get weaker. Everyone's does. And they produce energy. They produce anti-inflammatories. And they produce your sex hormones. So I want to make sure all of those are working the best they can. And that's another supplement I take is my adrenal support. So everything on the website, drjoe.com. Just go do it. At least get the Super Greens, the Essential Source. But I would recommend you do a lot more than that, but start there. And you want to make an appointment, drjoe.com. So the gut is the seat of the subconscious. This is interesting because for years we've always thought your subconscious brain is in your up here. It's not. It's in your enteric nervous system. Because there's 2 types of nervous systems in your body. You have your enteric nervous system, which controls your digestive system. And you have your brain function, which is up in your brain. And one controls the other. And that's what's so cool about this. So we want to make sure the central nervous system and the enteric nervous system are talking to each other. And we do that by way of something called the vagus nerve. Now, the vagus nerve is the longest nerve in the body. It runs from the left side of your brain down into your gut and controls all the organs in your body except your adrenal glands. Why it doesn't control your adrenal glands, I have no idea. The way we're made. But the vagus nerve is really important. So the gut can send messages, the bacteria in the gut can send messages up the vagus nerve, and the brain can send messages down the vagus nerve. The gut has 200 million neurons. That's about the size of a dog brain. Now, dogs are pretty intelligent. So your gut is as intelligent as a dog or more. And it's controlled by the upper brain. But they have to be working together. And this is the missing link, I feel, in emotional health care. No one's addressing the connection between the gut and the brain. They keep addressing the brain and ignoring the gut. When you start adding the gut in there, it's pretty cool. Again, 100 trillion microorganisms, they influence everything in your body. Who you are, where you are, if you're happy, if you're sad, when you die. Everything is influenced by those bacteria. So the enteric nervous system controls the gut. The upper brain controls the brain. And there's sensory and motor function that occurs with the vagus nerve. Sensory is it feels things. Okay, I touch something hot, that's a sensory reaction. A motor reaction is when I pull my hand away because it's so hot. So you have sensory and motor function in your body. You also have two types of nerves in your body. You have sympathetic nerves and parasympathetic nerves. Sympathetic nerves speed you up. Parasympathetic nerves shut you down or slow you down. Now, digestion is a parasympathetic function. Parasympathetic functions also include sleep, pleasure, romance, keep it clean, it's a family show, digestion, going to the bathroom. Those are parasympathetic functions. So if you're always stressed out, either chemically, emotionally, or physically, you're in the sympathetic mode. You're not downshifting to the parasympathetic mode. And when you don't downshift to the parasympathetic mode, the digestive system can't work properly. So you can't produce the right bacteria, you can't produce the right neurotransmitters, and then you have a problem. So if you're always in pain, if you're always in the sympathetic stressed out mode, you're not able to get the gut to work, to get the brain to work. And in fact, the digestive tract is one of your major immune system regulators. You might have seen commercials on TV. 70% of your immune system is in your gut. Absolutely true. It's those 100 trillion microorganisms that are living in your gut that help produce the proper immunity. So if you're messing up your gut, you're going to get sick more often. And not just cold and flu, actually more diseases. Wow. It's pretty heavy duty stuff, isn't it? Yeah. So there's a neurotransmitter, you've heard me talk about it before, called serotonin. Serotonin is produced because your stomach breaks down proteins into something called amino acids. The amino acid tryptophan becomes serotonin, and serotonin in your brain becomes melatonin. So serotonin is your happy neurotransmitter. It makes you happy, it helps you focus, and then enough serotonin produces melatonin, which helps you sleep, which kicks you into the parasympathetic mode, which allows your gut to function normally and heal so that it can control the brain. So you can't just treat one or the other. You got to treat the whole system if you want to get the results that I want you to get. So if you're not digesting your proteins properly, maybe you have acid reflux. How many people have acid reflux? Raise your hands. A lot of you. Acid reflux, heartburn, burping, gas, bloating, esophagitis. That's a new big word now. I'm seeing a lot of diagnosticians coming back. You have esophagitis. Acid is coming up into your esophagus. It's causing an inflammatory reaction, and you have it. And then my question is always, well, what are you going to do about it? Well, we can give you proton pump inhibitors, things that'll shut down your acid in your stomach so the acid doesn't come up into your throat. Does it work? Yes. However, when you take these acid reflux drugs, many times it prevents you from absorbing calcium, B12, iron, and magnesium. So you're not absorbing your nutrients properly, so that puts you in nutritional deficiency, which means your body isn't going to work right. So what I propose with acid reflux patients, most cases, not all, we actually take the stomach, we massage it, we pull it down away from the diaphragm. When we pull the stomach down away from the diaphragm, your body now is able to start digesting food physically, which allows the chemicals to interact, which passes the protein, the amino acids into your small intestine. Because your body produces a lot of serotonin. 5% of it is used in your brain. 95% of it is used in your gut. Wow. So serotonin is such an important neurotransmitter, and your brain only gets 5% of it. That's how important your digestive system is. It's stealing most of the serotonin to make it work. And serotonin does a lot of different things depending on what it needs to do. depending on your environment, depending on your stress level. So serotonin is one of these very versatile neurotransmitters. Most of it's being used in the gut. If you don't break down your proteins properly, you don't give your body the raw materials to produce the serotonin. And so the gut can't work, the brain can't work. Wow. Crazy stuff, I know. And why did you ever hear about this before? I don't know. Should have listened to my shows earlier, right? So if we can get the gut working properly, the brain oftentimes works because the brain and the gut communicate along the vagus nerve, and serotonin regulates emotions, much more complex system than we thought. So we got to get the gut and the brain working. Your gut can control emotions, and your brain can control emotions, and your gut can control your brain, and so they all tie together very nicely. So if we're doing things to mess up the bacteria, we're messing up function of the vagus nerve, we're messing up function of the enteric nervous system, and we got a big mess. Now, your gut can send signals to which the brain responds, even though those signals never reach your conscious awareness. So there's a subconscious control of your brain by your gut. And now think about this. Think about the phrases we've used in our society. I got a gut feeling about that. You did. You're absolutely right. It's not a brain feeling, it's a gut feeling. She broke my heart. She didn't break my brain, she broke my heart. So it's affecting the vagus nerve, it's affecting the enteric nervous system. That's where you feel your pain. You don't feel it in your brain. Makes me sick to my stomach thinking about it. It's a fun one, right? Makes me sick to my stomach thinking about. Most people don't know this. So you don't get sick to your brain, you get sick to your stomach. So most of the neurotransmitters, serotonin specifically, are being tossed around in your gut. So if you're not digesting your food properly, acid reflux, heartburn, burping, gas, bloating, it'd be a good idea to get that fixed. Now, some people come to me and say, Dr. Joe, I took probiotics. And it helped a little bit because the probiotics are the good bacteria, but there may be a physical component. And this is the thing that's missing in modern healthcare, the physical component of healthcare. Pinched nerves, stomach pushed against the diaphragm, spasms of what's called the ileocecal valve, the valve in between your small and large intestine. And when you add physical healthcare into the component, that's when you start seeing changes. I was on the Dr. Oz show a couple of weeks ago, and Dr. Oz and I did an interview together, and I asked him about trends in healthcare, and I said, what about physical healthcare? He goes, oh, absolutely, that's the big trend right now. So finally, the world is getting that if we have everything lined up properly, physically, we have the body chemically balanced, we have good nutrition in the body, and we have good emotions, which means if we fix the gut, we're able to have better emotions, the body is able to heal. So if you have neck pain, back pain, shoulder pain, numbness, tingling, stop suffering needlessly. It drives me insane. Been in practice over 3 decades. Patients come in every single day, say, Dr. Joe, I've had this problem for blank. When I say blank, 2 years, 10 years, 20 years, 30 years, since I was a teenager. I got hit by a car when I was a kid. I've had headaches. And we check them out. There's physical issues. There's bones out of place. The stomach is up against the diaphragm. There's spasms. And we fix the physical component. They say the same thing. Why didn't I do this sooner? Dr. Joe, why did I suffer for so long? And the answer is, I don't know. I don't understand that because you could have come see us. Been there for 30 years. Now, if you want to make an appointment, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. We would love to be your doctors. And when you come in, if we have something you think we can help, we'll tell you. If it's something we can't help, we're going to tell you that too. But I know this show goes all over the world, so if you're not in the Atlanta area, you come visit us, of course. A lot of people fly in from all over the world as patients. But if you want to do a phone consultation, we can do that as well. But when it comes to nutrition, this is so important because certain foods cause an inflammatory reaction. And if you have inflammation in the bowels, that inflammation can become systemic, which means it goes through your whole system. So I cannot tell you how many times patients have come to us, even chronic pain patients, and we work on getting their digestive system fixed. We pull the stomach away from the diaphragm. We get them on Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Probiotics, Dr. Joe's Digestive Enzymes, and we start to heal the gut, and their pain goes away, or their pain is more manageable, because inflammation can be systemic. So if I have an injury in my neck and I have a digestive issue, that inflammation can irritate the inflammation in my neck and cause me to have headaches or neck pain or hip pain. So we want to align all 206 bones in the body. So if any of the bones are out of place, we can put them back in place, including the skull bones. Then we work on the digestive system. Then we work on the chemistry. And you have control over the chemistry. That's the cool part. Patients come in all the time and they say, Dr. Joe, you talk a lot about nutrition. And I say, that's because you have control over the nutrition. Nobody's forcing anything to go into your mouth. So what I recommend is this. Your diet should consist of mainly fruits, vegetables, nuts, and seeds. Now, I know you think, There's about 120,000 choices between fruits, vegetables, nuts, and seeds. Then add Dr. Joe's Super Greens, Dr. Joe's Essential Source. If you've done anything to destroy the bacteria in your colon, antibiotics, chlorinated water, fluorine, sounds like all of you, right? You might want to take a probiotic as well. And if you're having acid reflux or heartburn, you're getting older, if you're over 50, I do recommend digestive enzymes as well. I take digestive enzymes if I eat a cooked meal. If I eat a raw meal like a salad, I don't take them. But if I take a cooked meal, I always have the digestive enzymes because I understand what's happening between the gut and the brain. And if you knew what I knew, you would do what I do. So if you want to make an appointment to come see us, order the supplements, go to my website, drjoe.com. Hey folks, I'm Dr. Joe Esposito. The website again, drjoe.com. Thanks so much for listening. Tell your friends about the show. We'll get you next time.
Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.